Hi, I'm Dr. Bowden. I am a registered dietitian. I have the opportunity to help patients who are preparing for surgery to be able to help work with your nutritional needs, because we have some very different and distinct needs when we're going into a situation where we're putting our body under a stress. So we have a stress response to the surgery. And what happens is our bodies have this wonderful ability to heal, but they use that ability to heal in conjunction with drawing protein, for example, from our muscles to be able to use that to heal. So if we can prepare for surgery by making our muscle stores, our protein stores, as optimal as possible, that allows us the opportunity to make your body be in a better place for recovery, because you may still be losing some of that protein that you put in, but you had more to start with. And because you had more to start with, that recovery process is going to go more quickly. Now, this is not just we eat tons of protein. The other aspect of this that we have to include is the activity. We need to add exercise and movement to move those muscles so that our bodies will want to incorporate that protein into the muscles. Along with that, we need the other micronutrients, those vitamins and minerals, to be able to help go through those processes that our body uses to be able to make that protein into muscle. So those are some of the things that we want to consider. We also want to consider things like, what are we doing as far as our sugar intake? Sugar tends to be pro-inflammatory. It makes it so our body's inflammation increases more. And so if we're keeping that low for the weeks before surgery especially, and then after surgery, that's going to help decrease that inflammatory response and also help us to heal more quickly. We also have things like making sure you're getting plenty of water and plenty of fiber. That's especially important if you've been on pain medication, to be able to help your bowels work properly. So the benefit with spending some time with a registered dietitian like myself is to allow you the opportunity to personalize this process, to help you understand what you've been doing with your diet in the past and what changes we could potentially make, as well as help reinforce the things that you've been doing that are going to make it so your surgical response is going to be really good. And so when we have that opportunity to meet one-on-one, we can fit these general nutrition guidelines for surgery to you and your individual needs. So the day before you go to surgery, besides being a very full and stressful and somewhat busy day, is also one that you're going to want to focus in particular on your nutrition so that you're preparing yourself for this surgery as best you can. So during that day right before surgery, you're going to want to make sure that you're eating healthy meals, and especially that evening before, have a meal that's light, as in you're not going to consume heavy, fatty, fried foods, things that are going to sit in your stomach for a long time. You know, those things that, the heavy desserts, things like that. And focus more on making sure that you're getting some good high quality protein, and you're getting some fruits and vegetables and some good whole grains, but you're not eating an excessively large meal, just a normal sized meal. And then the following morning when you wake up, we want you to spend time before that surgery up until that 2 hours before drinking clear liquids, being hydrated, and then having some carbohydrate and a little bit of protein in a liquid form is going to be able to help when you have that surgery to have your body function better and make it through that surgery a little better. One of the problems that we have is we develop what's called insulin resistance. And having that little bit of carbohydrate and a little protein in your body 2 hours before surgery is going to help make it so you're not going to have as much of a negative insulin response. So what do you want to consume? So one of the easy things is just have a supplement that's going to have just those carbohydrates and those already broken down proteins. One of those would be Boost Breeze. Another option, if that's not available, is a 1.5 cups of apple juice or white grape juice, a clear liquid juice that has that carbohydrate. You'll be missing those proteins, but you'll be able to get in that carbohydrate that will help. We don't want anything heavier than that, so having just a regular Boost supplement or Ensure supplement or a protein shake is not the right answer. That's going to be too slow to digest, and it won't be out of your stomach before you need to be able to have anesthesia, and we need to have your stomach be empty at that point. After your surgery, we have another opportunity here to help maximize your nutrition. So after you wake up, start on those clear liquids. Have clear liquids until you're feeling a little bit better and can start on something a little heavier, maybe some chocolate milk or a protein shake. And by 24 hours after surgery, some people are up for a meal, some people aren't going to quite be up for that. You can just kind of gauge how you're feeling, what your nausea is like, and make those choices that are going to be able to help you get back into regular foods as quickly as possible.